Hi, I'm Jonty Bunn. I'm a third year medical student. Actually, I don't know if I'd say the Bunn. Hi, I'm Jonty. I'm a third year medical student. One of the two.
What is your full title?
I think it would still be Master Jonty Bunn or Jonathan Andrew Gunton Bunn, Mr. Bunn. No doctor yet. So far, I've completed school all the way through and done 3 years of medical school. Obviously, kind of a year and a bit of that was COVID, so not much in-person stuff, but have started recently a 12-week placement that I'm 2 weeks into. So I guess my career history is 2 weeks as a medical student following around doctors and being the annoying one who asks them lots of questions.
How have you found it?
I do quite enjoy placement. It's way better than kind of sitting behind your laptop and like having to teach yourself the whole year because the med school aren't putting on enough lectures. So the placement's quite a good way of like getting hands-on, all the stuff that you've kind of like slaved away to learn, actually seeing it all put into practice and like how it actually fits into hospital care.
Is it different to how you expected it to be?
I think with placement it is, because the whole time before we started, we were told, oh, they'll be happy to have you there, they'll want to get you involved, you're not at all in the way. And then as soon as you start, you kind of realise that the consultants won't really want to look up from their computers when you walk into a room for fear that if they're too nice to you, then you'll latch on. And you realise that the junior doctors, so the F1s and the F2s, are usually the main ones who will kind of like take you under their wing and let you go around with them. But even like while you're following them, as nice as they're trying to be, you get the impression that they're like really busy, even if they're trying to like seem like they're not. So whilst you kind of want to ask lots of questions about what's going on, like get involved and stuff, you know that most of what you'd be doing is more of an inconvenience to them than if they were going about their day without you there. So it's a weird balance of kind of you having to know that you have to get as involved as possible for your own benefit, but also you don't want to get too in the way for the sake of the people who you're around there with. I think in terms of my career path, I'd probably be currently looking at going into like emergency medicine, which is kind of like A&E, which has been my main like dream job since I've been 15, 16. And that's the main reason I would apply to med school, thinking, oh, at the end of it, I'll become this big like A&E doctor, always really busy, kind of casualty-esque Dr. Bunn. And I mean, I'm 2 and a bit years in, and that's still my main focus, like getting through. But I'm quite aware that like as people go through, generally it kind of changes what they want to do as they go through medical school further and further. But currently still on the same path. We'll see how much it changes.
Why A&E in particular?
Well, GP has the same kind of variety of cases that you see. So with surgery, you've got like, you'll become really good at specific surgery. So like if you go into orthopedics, you might go to lower limbs. So then you're mostly doing knees and ankles. And then as you do more and more knees and ankles, you realize that you're better at knees and somebody else is better at ankles. So you'll just do all the knees, they'll do all the ankles. And then suddenly before you know it, you're kind of, each day you're doing 3 or 4 knee surgeries and not much else. And I feel like that kind of, although when I talk to them, they're quite happy with what they're doing and they say that they enjoy the surgeries enough that they don't mind doing them over and over again. I think for me, I'd rather do something that was more varied. So like you've got a patient coming in and they've got something going on with their like lungs or something, and then you've got another patient who comes in, they've got a big gash on their leg, and you're the common person they come to who can kind of like either sort them out or tell them where to go next. And I quite like the idea of having a variety of different patients. But you'd get that with a GP as well. I think what I like about A&E is the kind of urgency, the like action. I just think as somebody who gets bored quite easily, I'd struggle quite hard to get bored as an A&E doctor. I think for me, the reason I wanted to do medicine was the mix of a few different reasons. So everybody who does it will say that they want to help people. Kind of like whether you're going into actual hospital medicine where you're directly in contact with patients, or if you're even in academia where you're kind of trying to discover cures for various illnesses that they haven't found yet. Everybody's main focus is the health of either the population or the individual patient. That kind of combined with also the sciencey aspect. So at school I was never really much good at any of the artsy things. Wasn't even really that good at the sciencey things, but put in a bit of work towards the end so I could get in. And I think the mix of the science and the helping people is kind of the main reason. But as I've gone through, and it was mainly kind of the summer before I actually started medical school that I realised that my dad talks about it as like a passport. So the common thing that all countries will have is that everybody needs people that are going to help like patients and people who are going to like work in hospitals. Like I don't think there are many countries who have an excess of doctors, and it's kind of like having this degree and all this knowledge means that in any country I go to, there's kind of some way I can make myself useful. And I think as somebody who wants to do quite a lot of traveling, almost like traveling is like one of the main things that I want to do in my life. Like being able to have this degree that means that I can go to South America or like rural Africa or anywhere really and can make myself useful and get involved is something that like attracts me quite a lot about it.
So the last thing we're going to get you to do is write me a sick note.
Write you a sick note?
A proper doctor yet, but this can be practiced.
Oh, how embarrassing can we go?
Well, it can be whatever you think will be convincing. Ideally, embarrassing enough that they won't ask me any questions.
You've got to get some special treatment from a foreign country. There you go. Shouldn't be asking any questions about that. That was done.
Thank you, Dr. Bunn.
Thank you, Mr. McMinn.